head athletic therapist at Seneca College. He works with all of the varsity athletes in regular time when everyone's on campus. And now virtually, he's doing a lot of things virtually with our athletes just to keep them healthy and in shape. He has been, I don't even know how long have you been around at Seneca, Steve? A really long time.
This is my 11th year.
11 years. So a wealth of information. He is a go-to guy for a lot of people that have questions and concerns. So Steve, I will pass it over to you. You can take it away.
All right. Thanks, Michelle. Yeah, so basically like what Michelle said, I've been around for 11 years and kind of the athletic therapist for all the varsity teams. So I look after all their injuries as they happen and heal them up through the whole process. And I've taken as well as doing that with my requirements. I'm a first responder as well. So a lot of the stuff we'll be talking about is coming from that type of idea. How we injure, if you get injured at home, what you should have with you, and how you're going to handle some of those common injuries that might happen while you're at home or on residence or anything like that with it, so you can manage it yourself as best you can and know when to get help with if you need more. So I'm going to share my screen. I put together a little bit of a PowerPoint here and see if I can get her going.
And while Steve is putting that up, I just wanted to let everyone know that we're going to have the chat active on the side. So I will be on screen the whole time as well. And if anyone has questions, feel free to put it in the chat because I'm going to be monitoring that and can jump in and ask Steve any questions. So feel free to ask them either in the big group chat or just personally to me or to Steve because we're here to help.
Yeah, and feel free to ask along as we go. Don't wait till the end. If something pops in your head on a topic we're talking about, ask away. Okay.
Perfect.
So I'll get started. So like I said, I'm going to talk about first aid information with you guys. And the first thing that, why is that not working? There we go. A first aid kit. So everyone should have something in their home as far as basic first aid supplies in case you get cut or get hurt and things like that. So this is the real basic type of materials that you need to have in a first aid kit. And I kind of have them all here so I can show you. So like with Band-Aids, I have 2 or 3 different ones in mine at home. With my screen, you can see it. I have like a straight one. I have one that's like a knuckle. It's kind of shaped that way. The background's messing it all up. And like a different like kind of little butterfly shaped one. So for different areas of my fingers or things like that that might get cut, or my kids if they get cut, I have the different Band-Aids available to fit the need of the area that it's cut. Gauze, same thing. I have a couple different gauze pads. So there's one that's like just your regular gauze wrapped up in a sterile package. And then I have one here that's called a non-adherent gauze. So this one is really good for that. We'll touch base on it later on in the presentation on how to manage some wounds and things like that. The non-adherent one is really good because then it doesn't stick to the cut or the abrasion or things like that you might get. And then that way it doesn't rip off any scabbing that's happening, but it still protects the wound. So we'll talk a bit about that later on. Alcohol wipes. So I just have little wipes instead of getting a whole bottle of like a peroxide or anything like that. These are nice and handy. You just open it up and can wipe away the dirt and debris that you might have. Tensor bandages. So again, I carry 2 different sized ones with it so that again I can use it in different areas of the body, more for maybe around an ankle or a hand versus around a knee or shoulder, that sort of idea. Triangular bandage, so basically a sling, okay, folded up there in a little package so if you need to use a sling. Ice packs, there's lots of different ones out there. So there's like a hard one like this that a lot of people have in their fridge. I like to use these ones. These are moldable, reusable ones. These ones are great because you can put it around the area that's hurt and it can fully surround it. If you don't have any of those type of ones at home, you can also just use a bag of frozen peas or frozen vegetables. We'll do the same thing and be able to conform around the area that's hurt. Medical tape. Okay, so I have a roll of medical tape with me. Again, I use this to hold on the tensor bandages, hold on gauze, wrap something on, or be able to tape something up if I need to, and then some gloves so that you can help protect yourself if you're helping somebody else. As well, you don't want to get any dirt into any wounds if you are using anything to fix yourself as well, if you're able to. So those are just some basic things that you can have in a first aid kit. Yes, there's lots of other things you can have in it. This is bare basics of things that you would most likely use with injuries that might happen in and around the house. So we're going to talk a bit about some of the different types of injuries that can happen. So this one is, first topic is with wounds. So the first one I'm going to talk about, so abrasion. So an abrasion is very common. It's basically when your skin gets rubbed or scraped away. So you can see on his face, he's got the abrasion on his cheek there. So it's often referred to as a rug burn or road rash, are very common terms that you would hear for like an abrasion. Basically what it is that removal of the outer layer of our skin. So it's just the very top layer, exposes the nerve endings at the top. So that's why these abrasions or rashes can be very sensitive and painful, because it's revealing kind of the nerve endings on our skin and not really getting deep beyond them. They tend to vary in the bleeding, so they don't tend to bleed a whole lot, again, because it's very superficial on the skin, and you're able to control the bleeding relatively quickly there, where you're not getting into the thicker veins or arteries below the skin level. However, infection is a very serious concern with abrasions, often because of how they happen. When we're rubbing against the floor or rubbing against the ground or something like that, obviously there's a lot of dirt and debris in the area that can get into the skin and can cause an infection. So that is one thing that you need to be cautious of with that when you are taking care of an abrasion, to make sure that you really clean it, which is what we'll talk about now. So caring for those abrasions. So as I mentioned, infection is really high when it comes to abrasions. So cleaning the wound is key. The best way to clean any sort of wound is just flush it with water. Preferably if you have like a running water, so either from a hose or a tap, something like that, where you can run the water over the area. That's going to help clear the debris from the wound and not allow it to kind of get set in to the area and create that infection down the road. Alcohol, using like these alcohol wipes, you don't want to use any of them directly on the wound. It can actually cause damage to the sensitive tissues underneath the skin. So if you are using the alcohol wipes, you want to use it kind of around the wound, so on the skin that's not involved, and clear any of the debris or dirt in the areas from that area. And what you want to do is actually from the incision or the abrasion, go away from the wound when you're wiping. So don't wipe towards the open cut, wipe away from it, so that you're wiping any debris or dirt away from the wound to stop that, decrease the risk of infection as well. Okay. Same with that next point. So avoiding touching the open wound as best you can. That's where your gloves come in handy. Or you can put those on to help while you're cleaning any abrasion. And I said wipe away from the wound. Taking care of it, so you can apply like an antibiotic, and I don't think I showed that in my initial one with it. So like a polysporin, like a topical antibiotic, or bacitracin, those type of things are great for helping with decreasing infection rates. So you can apply an ointment on it and then cover it with that non-adherent bandage I was talking about, so it doesn't stick to the wound. You want to do this, change the dressing daily, and clean with just soap and water, and reapply fresh bandages every day. And you do that for a couple of days. And then what you actually want to try and do, especially if you're like lounging around at home or at night and stuff, remove the bandage to let air at it, so that you can actually form a scab and heal up. If it's constantly covered and has the ointment on it, it's going to take a lot longer to heal, because it doesn't have the air to help dry it up and promote that healing. So I often recommend after those couple of days, if you're out at school or walking around, or if it's like a scrape on your knee and you have pants on, then cover it for that, because you don't want it to be irritated. But at home, as best you can, have it open and to the air, so that it can promote that healing process. Watch for that infection. Signs for infection is that it'll get swollen, red in and around the area, and may produce like a discharge or like a pus, and that can be kind of like a yellowy discharge around it. So if any of those things are happening in and around the wound, I would go and talk to your doctor and get it looked at. Maybe you need to get on a antibiotic pill form or something to help with that. Laceration, so is another form of a wound. So a nice picture there. I hope nobody is queasy with blood. So that basically is the care for a laceration is very similar to an abrasion, but we'll get into that in a second. So laceration is basically a cut. So it's usually caused by a sharp object. So it often happens in the kitchen when we're prepping for dinner or making foods. We cut our fingers with a knife, it slips, or we break a glass, or common ways that it can happen. It can be either be a smooth edge or kind of jagged in that cut with it. So where we want to be cautious with it is those deep lacerations, so they can affect the different layers of our skin, so it can get into your fat and your muscle, and damage either nerves or blood vessels. So if it's really deep, that's our concerns. The very superficial ones on the top layers heal relatively easily, and are well managed on your own. Often because when we cut through things, it goes through those deeper layers, they can also injure the nerves. They may or may not be painful lacerations. Sometimes if you've cut yourself, you're like, oh, I didn't even notice that I cut myself because it didn't really hurt too much. Because you've kind of gone through and past those nerve endings, so they're not really touching, and that's not creating the pain signals. So that's why sometimes lacerations or those cuts don't really hurt a whole lot, but they still need to be managed properly. So the cleaning for a laceration, like I said, is very similar to an abrasion. So any wound, we want to flush it with running water, avoid using alcohol directly on the wound, and touching it, and clean it and monitor for those infections. With a laceration, the big thing that we want to really work on is stopping the flow of blood, okay? So sometimes lacerations can just kind of trickle out some blood. Sometimes they can kind of really pour out a little bit more blood onto it. Big thing is applying direct pressure with a clean cloth or your gauze. That comes in handy in the first aid, especially if you can with a sterile one. If there's nothing around, then you grab whatever you can, obviously, right, as needed, a paper towel or whatever you can with it. But if you have the sterile ones in your first aid kit, try and put those ones directly on the skin, and then you can add other things on top of it. So we want to try and keep the sterile one on the wound to, again, help prevent infection. If you need extra stuff on top, then you can add other things like toilet paper, Kleenex, or whatever you have laying around, a towel, okay? Once we've controlled that bleeding and the bleeding has stopped, again, we can apply an antibiotic ointment with a non-adherent bandage. And then usually with an incision like that, depending on the size of it, we'd wrap it more with either the tensor bandage. I think my next picture here shows, yeah, with like using like a gauze roll, but that gauze roll, you can just sub that out with the tensor bandage. But essentially, you apply your gauze to the area, wrap it up. That's going to help keep pressure on it and control the bleeding. Make sure that when you do that, in the last picture here where it's checking kind of the finger there and pinching the finger, what they're looking for there is that if you squeeze your finger, it should turn white, and then it should kind of come back into the fingernail pink relatively quickly within a 1 or 2 second count. If it's really slow coming back, then you've tied this too tight, your tensor bandage, okay? And you're cutting circulation off. So we want to make sure that we're not cutting any circulation off to the rest of our hand if we have a cut on our arm or anywhere else below the cut. So just make sure that you're not doing that too tight, but applying enough pressure. Again, after 2 days, you can remove that bandage to promote the healing. I put a little note down here, right? If that wound, if you cut, is spurting blood, I'd be calling 911 right away and apply direct pressure to it and elevate until help arrives with it, and listen to what the 911 operator tells you at that point. But if it's spurting blood, then that is a deep cut, and you've done some good damage there. So fortunately, most cuts are very superficial, and you can manage them on your own. Stitches. So that's a big question that I get a lot with my athletes when they do get cuts is, do I need to get stitches or not? So again, sorry for anyone that might be queasy with the picture on it there, but so that's like an avulsion. So the skin is kind of flapped up. So basically, the guidelines for stitches is if it's really hemorrhaging, so if it's like kind of really bleeding hard, if the edges of the wound are jagged, so kind of like in that picture where it's kind of not a clean cut like it was in this picture here, it was a nice clean cut, then you would want to get stitches. They say anything longer than 1 inch. So if the cut is long, longer than about 1 inch, stitches are recommended. Anything on your head or face, anything where you're moving it. So if it's in your hands or in a joint where it's bending a lot and moving a lot, it's going to stay hard to keep the wound close together to heal. So that's where the stitches would come into play to keep it close so that it can heal up and you can still move around. And then there's some of the other points there, right? So a really large, deep puncture or something embedded into it, a human or animal bite, hopefully doesn't happen, but it can be done. And the guideline is of when they will stitch things is about a 6-hour window. So if you get it cut and you're unsure if you should get it stitched on, and you know it's now 8 hours after the fact, you can still go, but it's usually a 6-hour window of where they're able to get a good stitch in and be able to stitch it up well for you that way. So keep that in mind as well on if you're humming and hawing, if you need to get it done. That's kind of usually their guideline for it as well. We'll get into burns. Again, another thing that can happen in the kitchen a lot. So when we're cooking and stuff, burns often will happen. Either water splash up, you touch a pan by accident. It happens all the time. So burns are kind of categorized by different things. So a burn is basically a soft tissue injury, and it can happen in 4 different ways. So heat is the most common one that you'd see at home, or radiation, so basically a sunburn. Chemical or electrical burns you probably won't see too often, or hopefully not come across in your home, but you can get burns for it that way. We're going to talk more about the heat ones and radiation. You kind of treat those the same way, and kind of might be more relevant for any injuries that might happen in the home. So basically it affects the epidermis, so it's the outer layer of our skin, and then as the heat source is there, it tends to penetrate deeper. So the deeper the burn, the more severe type of burn it is and the more tissue that it's affected. Basically, they kind of classify it into 3 different areas. So there's superficial burn, which is like your sunburns or a very quick burn from the stove or hot water. A partial thickness burn is kind of what they classify as that 2nd degree burn, where you'll get some blistering, and it gets deeper into the skin layer. And your full thickness burn is a 3rd degree burn, where you definitely need some medical intervention to help with that one. So again, we'll be talking mostly about that superficial or 1st degree burns onto it. So as I said, superficial burns is kind of that 1st degree burn, and it just involves that top layer of skin. The burnt skin, it tends to just kind of be very red, dry. It's usually very painful. If anyone's been burnt, they can attest to that. And it can swell up in that area as well. Usually they heal pretty well, usually within a week's time, and there's usually not really any scarring or anything like that that can happen with it. A partial thickness burn or a 2nd degree burn, like I said, involves both layers of the dermis and epidermis layers. So it gets a little bit deeper. And they tend to, like I said, have blisters that will form and can kind of open and weep clear fluid. So it kind of makes the skin kind of appear wet. These ones are very painful, and sometimes scarring can happen with these ones. I recommend if you get any 2nd degree burning and the blistering that you see your doctor with that. We'll talk about the initial management, but I think you should follow up and see your doctor definitely with any 2nd degree burns. 1st degree burns, like I said, they usually heal well on their own and usually within that week's time. Treatment. So the picture here shows exactly what you would like you to do. Ideally, if you can, fully immerse the area that got burnt to really cool it. So if you think of a burn, right, obviously it's heat that's creating that burn. What we want to try and do is counteract that heat. So we use cool water to run it down and cool down that heat on our skin. That's the way that we're going to reverse that burning process. When we have something that's on us, like a hot water or even like an oil or something like that, it stays on the surface and it continues to kind of burn. And that's why if you ever burn yourself and you run it in water for like a minute and you take it out and then it starts to really hurt again and burn again, and then you put it back under the water to cool it down. So we want to try and keep that water running on it for at least 10 minutes to really take that burn sensation and stop the heat transmission through the tissue as best we can. Ideally, we'd like to try to immerse the area totally if we can. So if it's your fingers, you can grab a cup of cool water and just put your fingers into it, or a bowl. You can put your hand into it. Obviously, if you burn it up like in this picture into your forearm, it's a little bit harder to do. So running cool water on the affected area is your best option. You can use like a cloth or gauze compost and soak that and apply it to the area that can't be immersed. If it's too painful to run the water over top of it or completely immerse it, you can use a cool compress and just keep adding kind of water to it, because as you have that water on it, it's going to not be as cool. The heat from the burn in your skin is going to warm it up. So you want to try and keep that cool water on the whole time as well. Treatment. So way we want to treat the burn is cover the burned area to protect against pathogens, so infection, and to help reduce the pain. So again, you can kind of apply a cool compress to it and can wrap it. You don't want to put too much pressure on it though, because you don't want to trap any heat that might be still there in it. So just kind of loosely bandaging it in place to kind of hold on to it. Again, that dry, non-stick, sterile dressings with it. You can use that moist dressing that we talked about if it's at the beginning to help reduce the pain, if that helps. If it's not painful without having the moist water or the compress on it, then you can use just a dry, non-stick, sterile dressing. What we don't want to be done on with burns is put any ointments on it. So they use this thing like butter, cooking oil. I'm not sure why I'd put butter on a burn, but apparently people do onto it, or any like commercial salves or things like that that are for burns onto it. The reason why we don't want to put anything on that there is it actually creates a seal over the area, and again doesn't allow the heat to escape, and it can continue to cause burning into the skin deeper down. So we don't want to put anything like that directly over top of a burn. We want to let it kind of be loose and open to let the air and the heat disperse from the tissue, so it doesn't continue to burn even after we've cooled it down. Okay, that's kind of a big thing that we would want to avoid with our burns. Nosebleeds. So the fancy word for nosebleed is an epistaxis. That's why I kind of put it under there, just a fancy fun name. So I'm gonna take a sip of water here as we take a break. So nosebleeds can happen for many different reasons. Most often cause is you get hit in the face. So it happens around here a few times. At my house, I have 2 young kids. Hopefully so far none of them have started a nosebleed from throwing their Legos and toys at each other, but that often happens. Or playing sport, we get a ball or something hit in the face, or you run into somebody. Easy enough to do, even just in the kitchen, leaving a cupboard door open and hit the bridge of your nose. Often, sometimes too, high blood pressure or changes in altitude, so flying and things like that can cause nosebleeds. A foreign body in the nose, so something gets shoved up there. Again, often you see that with kids, and they shove some stuff up their nose or in their mouth and different things that way, or any sort of head trauma. It can create nosebleeds sometimes. Best way to control a nosebleed is by sitting like this. So you want to kind of sit down, lean forward slightly, and use your gauze pinching the bridge of your nose. Okay, that's our best way of stopping that nosebleed. Basically, with the nosebleed, we want to, like any bleed, like your lacerations, we want to have direct pressure on it. We're not going to be able to do that by shoving our fingers up our nose and stopping it that way. So we do it on the outside and pinch the bridge of our nose to control that bleeding. You can apply an ice pack or cold compress to the bridge of the nose. Don't put it to the back of the neck. You see that a lot with people when they have a nosebleed and somebody comes and puts an ice pack on the back of their neck. I think their thought process is that they want to try and slow the bleeding down, because that's what ice does. But the arteries and veins on the back of our neck are nowhere near our nose. So we also, by having on the back of our neck, we also then are slowing the blood to our brain, and they often then will feel dizzy or faint because we're slowing the blood to the brain and not to our nose. So if you put the ice pack on the area where it's bleeding, is your best bet for controlling the speed and slowing down the nosebleed for it that way.
Just a quick comment, Steve. Sorry. Yeah. someone wrote, a lot of people think leaning backwards helps, but it's not. It's true. You don't want to lean backwards because you don't want the blood to go back up. You want it to come out.
Absolutely. Yeah. We don't want it to go back into our throat. So when we tilt our head backwards, our nose and throat are all connected. In COVID times, if anyone's had a test, that's how that's done. So they test through your nose, but they swab in the back of your throat. So if you're bleeding in the nose and we're tilting our head back, it goes into our throat, and you can actually cause somebody to choke if there's enough blood or anything like that with it. So then you're getting into a whole other problem and a breathing problem with it that way. So yeah, we want to lean forward and get that blood out of our nose that way. Once the bleeding is stopped, this is always a good one, because we stop bleeding with our athletes, and 2 seconds on the field, I look over and they're blowing their nose or rubbing their nose, and then it starts to bleed again. So avoid rubbing, blowing, or picking your nose if you had a nosebleed and it stopped. All you're doing there is taking the scab off, and it starts to bleed again. So to avoid doing all that as best you can for a few hours anyways. If you do need to blow your nose, wait as much you can to allow that to heal over and not reopen the scab. Okay, so musculoskeletal injuries. So these are, again, just kind of injuries to our muscles, bones, and ligaments. So common ones are your fractures, dislocations, sprains, or strains. Okay, so difference between that sprain and a strain. Sprains tend to be kind of in and around the joints. So your ankles, basically you're affecting the ligaments of the joints, whereas a strain is like a pulled muscle on it that way. So we'll talk a little bit about those and how you manage that. Just looking at time. Okay, are we okay for time, Michelle?
Yep. I was just going to jump in and say, careful of your time, but keep going. You're doing great. Yeah.
Okay. So common signs and symptoms. So basically, with most musculoskeletal injuries, all those ones, if there's pain, swelling, deformity, discoloration of the skin, so bruising, and your inability to use the affected part normally, are your kind of 5 common signs that you probably have some sort of musculoskeletal injury. The best treatment for it is RICE. So if you think of that, you need to rest, immobilize it as best you can. So try not to move it. Use cold, so ice it, and elevate it up as best we can. This is going to work for pretty much all those ones: fracture, dislocation, sprain, and strains. Especially with fractures and dislocations, you really want to immobilize that until you can get further medical professionals to look at it. When to seek your additional help. Again, if you're queasy, sorry for the picture. Basically, if it's hemorrhaging, so really bleeding a lot, involves your head or spine, impairs your breathing, deformed limb, like in our picture there, or your inability or reluctant to use the limb, is when you should seek additional help. So go to the emergency room or see your doctor for any of those musculoskeletal injuries that contain any of those red flags, we call them. Ice or heat is a big question that people always ask me. Do I ice an injury? Do I heat it? You can't go wrong with icing something for the first 24 or 48 hours, where you can go wrong icing something, putting heat on something, with it that way. So when in doubt, put ice on it. Basically, like I touched base on it a little bit, is that it constricts the blood flow, slows it down, decreases pain, and controls the swelling. Heat is a vasodilator, so it increases blood flow, decreases the pain still, increases the swelling and stuff in the areas. So in the first 72 hours, try and use ice. After that, if it's a muscular injury, then you can use heat on that if it makes it feel better. If there's still swelling in the area, I would stick to try and using ice. Best way to ice: wrap the ice pack in a damp towel, so a dishcloth or paper towel, moisten it, wrap it in the ice pack so it's not directly on your skin, and wrap it onto your affected area for about 10-15 minutes. And you can do that every 1 to 2 hours. That C-band I wrote there is basically the mnemonic for the stages that it goes through when you have ice on you. So it goes cold, burning, achy, and then numb. So once you've hit that numb stage, take the ice off. Anything you have with the ice on it past that, all you're doing is putting yourself at risk for frostbite, and it's not doing any benefits for the healing process or anything that way. So that's how you want to ice, and go through that. I'll leave it at that for questions, if we have any time, if you don't have any.
Yeah, we're great on time. That is excellent. I've never heard C-band before, but I like it because a lot of people think that I'm just going to leave the ice on as long as I can because it's helpful. And then all of a sudden, I actually had this many years ago. I got freezer burn from having ice on too long. It was a big red patch on my, yeah.
These hard
Yeah.
freezer packs that are these chemical packs and stuff are the worst for that, because they're very bad for that. So that's definitely why we always want to wrap it as well, and just take it off when it goes numb, and then you're done. Yeah.
Excellent. I just wanted to open it up to see if anybody had any specific questions that they want to ask Steve. Like I said, he has a wealth of information. So if you have questions about things that you might come across, things that have happened to you that you have questions for, anything that you think he can help you with, this is a great time to ask while you have an expert with you. So either in the chat, you can take yourself off mute, but you can ask him directly, or you can go through one of us in the chat. Will this presentation be posted on Instagram? It's not going to be posted on Instagram, but it's going to be posted on the website. So I am recording it. I forgot to mention that at the beginning, so my apologies. But I am recording it, and we are reposting all of these on the website. And I can certainly look into seeing if we can post it on Instagram as well, because it is very valuable information. But if you go back to our website, senecasting.ca, and you click on the adulting programs, you'll be able to see, whereas now if you click on it, you'll see a Zoom link. You'll be able to see, and I think it's called a recap, where we'll be reposting this presentation. So if you need to go back and look at all those slides again, very, very helpful. Any other questions about anything? What to do when you are choking alone is asked. That is an excellent question.
That's a great question. I actually had that added into the end of my presentation in case I had time to talk about some of that. So I will actually talk about that. So I actually have stuff here on the slides. Let me see if, sorry, 1 second, so I can keep it. Why is it not moving? Choking, yeah. So basically,
You knew this was coming.
I know. I'm like,
Yeah.
we added it in just in case we get time. So I'll go to SelfRescue, because that was what the question was about. So basically, if you are choking and there's nobody around, if you're by yourself in like you're in your room at residence or something, and you know there's somebody next door, try to get to somebody that's around so that they can see that you need help and they can help you as best you can. If there's nobody around, you call 911 immediately. If you can't talk, obviously because you're choking, you just leave it off the hook and they will send people to you. If nobody says anything when you call 911, they immediately send help right away to you, and get it going that way. If possible, like I said, try and find somebody, and then you can try to perform essentially a self-Heimlich maneuver, or those abdominal thrusts. So if you can, you try and find a blunt surface. So the edge of a chair works really great, because then you can kind of get over it and you're not going to worry about hitting your head on anything as well, like a countertop or anything that way. But if you can hold on to the chair, and essentially what you're doing is throwing your stomach into the top of the chair and trying to create an abdominal thrust on it to help force the air up and push the obstruction out of the airway, is your best way to do it. And basically you just keep trying to do that. If you're choking and you're still able to cough, first try and cough as much as you can. Try and cough as hard as you can. That's your best way to do it. If you're helping somebody choking, we encourage them to cough first as best they can before we intervene and try to help. But again, if you're on your own, try and use a chair, and as best you can to try and force that out. But call 911 first so somebody comes.
Yeah, that's a great question. Also, a 911 tip. Also, if you come across an accident, anything like that, anything, if you're on your own, you want to call 911 right away so you can get that help on its way while you're helping somebody. So that is a good tool to know. And everyone's got cell phones these days, so everyone probably has access to that pretty much right away. Any other questions that anyone has? Oh, I have another question. What should you do if they pull/tear a hamstring and have trouble walking as a result?
Yeah, so again, kind of if you have those guidelines I said on when to seek extra help. So if you are unable to use it or reluctant to use the area, then I would go see your doctor with it. Because if you've torn that hamstring and it's completely torn, they're going to need to do more intervention than just icing it and wrapping it. if you've torn, so if it's that case, you have really trouble walking as a result, and you really can't put any pressure on it, I would go see your doctor, or go to an urgent care center to have them take a look and make sure that it isn't a complete tear of that hamstring or any other muscle that you might strain or pull. If you're able to still function with it, it hurts a lot to use it. Crutches, if you have any laying around, or if you have friends that can that have any that you can borrow or get, crutches will help kind of take the stress off of it and help you get around while you need to do while it's healing up a little bit.
And I'm just going to jump in and add that sometimes you're hesitant, especially nowadays, to go to see a doctor or an urgent care or even the hospital because you don't want to go to a medical clinic. But sometimes it's better to know what you're dealing with, because you would treat a pull differently than a tear. So you don't want to do more damage. So if in doubt, you seek medical attention, and sometimes they'll just, they'll triage over the phone or something like that. And that might be your first step. And then maybe send you for some imaging or something like that. But it is always good to know what you're dealing with so that you don't do any more damage. It's a great question.
Yeah.
Any other questions that we have? And we can do a really quick Kahoot just to finish it off about some house things. But I think these are great questions. And while we have this fabulous resource, who is Steve, who is my go-to person all the time also, let's definitely get the most out of him. So I'll give it another minute. Any other questions for Steve while we have him here?
And if anyone has any questions after the fact, they can always reach out to me. You can send me messages through Instagram. It's just stevecopus_AT, or through the Seneca Rec Instagram. You can connect through with Michelle, and she can forward on any questions to me if you do have anything after the fact.
Absolutely. Everyone should have my email address from sending out information here. And as well, you can find Steve's email also on our website if you need to do that as well. Okay, so is it true? Oh, this is a great question. Is it true that it is mandatory to ask consent before you do first aid to someone? And here in Canada, it might be different I know Steve will talk about this, but I only know how it works in Canada. Go ahead, Steve. Yeah.
Basically, if they are unconscious, then no, you obviously don't need consent for it with it that way. If they are a conscious person and talking, yes, you should always ask for consent. If they become unconscious after the fact, then you can help them, even if they've said no to help initially, because you have the right to be able to help somebody and help them through a situation. So it's one of those kind of questions. Is it mandatory? It's not necessarily mandatory, but yeah, absolutely, you should ask for consent to help somebody, because I think you would feel weird if somebody just came up and started helping you and you didn't need help, but they thought you did. So definitely always ask to make sure that it's okay. But if they are unconscious, you don't need permission to help them.
Yeah, there is something called the Good Samaritan Act. I think that's if someone's unconscious, for example, like Steve was saying, and you do help them, and then they're like, well, I didn't ask for help. Why did they help me? It's implied, especially if they're unconscious, that you were there to help them and to assist them. And so you're not going to get into trouble for helping them, but it is the right thing to ask. It is a very gray area kind of subject, but it is the right thing to do, is to ask for help, because they might not want it, they might not need it, that kind of thing. It's a great question. Any other questions? Again, keep going. Feel free to put them in the chat, and we're always happy to answer them. I'm going to try to share my screen here, or wherever that is. If I can find my screen. Okay, just a moment, because it is not show all my windows. Hold on a second. I have a lot of things on the go. Okay. So this should work. Present, I hope, works. Classic. Oh, I've got really great music. Oh, okay. It's loading the pin. So if anyone wants to play the Kahoot, if you've downloaded the Kahoot, I think it's kahoot.it, So you can download that on your phones, on your computers, anything like that. We're just going to do a really quick fun activity just to end this off. I will read out the game number is 204-7231. So feel free to use whatever name you'd like. 204-7231. Anyone is welcome to join. Can everyone see my screen? That hopefully. I see a couple people have logged in. There we go. And anyone else want to join? I got 3 people. We can play with just 3 people. I'm okay with that. So I'll give it another minute if anyone else wants to join in to play. I'm just going to go back to my, are we good? I'm just trying to, all right, well, we'll play with whoever is joining. So just a second. Okay. All right, so we will start. A kettle, that's right. You chew on a kettle to make things. Let's see how we're doing.
Ooh, Cass.
All right. Question 2. If you wash a red hoodie with a white t-shirt, the white t-shirt might turn.
This is we're going over my colors.
The white t-shirt might turn pink. So that's why you want to separate your laundry. You don't want to have whites and darks in the same one, because if you have red especially, it might change all your colors. So you got to be careful about that. All right, if your toilet gets clogged, what should you do first? That's right. So this is important. Everyone should make sure they have a plunger in their house, because that is a good thing to have. We have Cass, who is really on fire right now. All right, next question. A few items to keep in your kitchen for easy, inexpensive meals should be. Exactly. Well done, everybody. Those are good staples to have. Oh, and we have a new leader. Okay, this is a true or false one. I can use the same soap to wash my dishes and my clothes. Good job, everybody. This is not a good idea. There's different things for different purposes, and make sure that we have everything that you need so that you are washing things properly. How often should I wash my sheets? At least every 2 weeks is important. People know that they're not supposed to wash. People don't think you're supposed to wash sheets. You are. You sweat at night. You expel lots of things. So it's really important to wash your sheets. Oh, Cass is back in the lead now. When shopping for groceries, make sure to pick up. Good job, everybody. Always good to have things like that in your house for staples. You can have quick, easy meals. An easy all-purpose cleaner. It's not a trick question, I promise. You want, yeah, Lysol wipes. We use Lysol wipes on everything. It's good to have. We do door handles, light switches, all sorts of things, countertops, great to have in your house. All right. If you're cooking in a pan and it catches fire, what can you do? There's two possible answers here. You can do two answers if you want. Okay, well done, everybody. I'm glad no one's making s'mores on our fire in our kitchen. This is good. Fire extinguisher is another great thing you should have in your house. Always important to have that so that you are not caught off guard with a fire. If you smell gas, you should. Excellent. Well done, everybody. We're not just ignoring it or lighting a candle. We are getting out and getting help. All right. Question 11. You should always consult Google for all your medical needs. Steve has a look of horror on his face. Thank you. Listen, we all Google our medical things. We know we do, but that should not be our be all and end all or our go-to. Let us check our leaderboard before the last question. Okay, we have Cass who has a good lead here. And our last question, true or false, the Seneca Health Center is open and can offer virtual appointments. Also up there, I have the telehealth phone number too. Telehealth is an excellent resource if anyone if you're in Ontario, you can call telehealth because they're 24 hours a day to help you, a registered nurse. Hard to get through sometimes, but that's a great question that you can call. The Seneca Health Center is actually open, so you can email them at seneca.health@senecacollege.ca. Give them your phone number, your student card, all that information. They will get back to you with a virtual appointment. So that's really good to know. All right, how are we doing on our podium? Steve is in third place. Congratulations, Rab. And our winner is Cass. Well done. Good job, everybody. So thank you all for joining us. I really appreciate everyone's time. I am going to be putting this up on our website. Again, a huge thank you to Steve for that valuable information. Hopefully everyone has learned a lot. And again, if you have any questions, you can reach out to me, reach out to him through me. And I hope everyone enjoys the rest of your day. Thank you, everybody. Take care.
Hi, everyone.